Today, we are covering integumentary assessment, a topic the NCLEX loves to test because it reveals so much about a patient's local and systemic health. Let's start with the basics. When you assess skin color, you're looking for more than a tan. Pallor in a light-skin client or an ashen gray color in a dark-skin client can scream anemia or shock. Jaundice, a yellowing of the skin, and sclera points to liver dysfunction. Cyanosis, a bluish tint, signals hypoxia. The exam won't just ask you to define these terms. It will present a scenario, such as a patient with a history of cirrhosis whose spouse reports their eyes look yellow, and ask for the nurse's best initial action, which would be to perform a full skin assessment. Next, consider turgor and moisture. To assess turgor, you gently pinch the skin over the clavicle or forearm. If it remains tented after release, it's a classic sign of dehydration. The NCLEX will test this by asking you to identify which finding indicates a fluid volume deficit. Cool, clammy, and moist skin is a red flag for shock or a hypoglycemic event. Now for the most heavily tested area, wound assessment, specifically pressure injuries. You must know the staging criteria cold. A stage 1 pressure injury is intact skin with non-blanchable redness. The key word here is non-blanchable. If you press on a red area and it turns white and then red again, it's reactive hyperemia, not a stage 1. The exam will trick you on this. A stage 2 injury involves partial thickness skin loss, presenting as a shallow open ulcer or a blister. A stage 3 injury is full thickness skin loss, where subcutaneous fat is visible, but bone, tendon, or muscle are not exposed. This is a common exam distinction. If you see slough or granulation tissue, but the deepest visible layer is fat, it's a stage 3. A stage 4 injury is full thickness loss with exposed bone, tendon, or muscle. Finally, an unstageable injury is when the base of the wound is covered by slough or eschar, making it impossible to determine the true depth. The NCLEX loves select all that apply questions about risk factors for skin breakdown. Think about the Braden Scale components: mobility, sensory perception, moisture, and nutrition. A low Braden Scale score means a high risk. So a question might list several patients, and you'll need to identify the one most at risk, like a client with a spinal cord injury who is also malnourished. For surgical incisions, use the mnemonic REEDA, which stands for Redness, Edema, Ecchymosis, Drainage, and Approximation. An exam question might describe a 3-day post-op incision with moderate redness, swelling, and purulent yellow drainage. Your job is to recognize these as signs of infection, not normal healing. To keep it all straight, remember this simple phrase for your basic assessment: TLC for the skin, T for temperature and turgor, L for lesions and location, and C for color and characteristics. This ensures you cover the critical points every time.